The use of so-called skin whitening and brightening products is on the rise in Australia, but many dermatologists are concerned about the risks associated with using some of these products. Well, Dr Ritu Gupta is a specialist dermatologist with Platinum Dermatology. She joins me now in the studio. Thank you so much for coming in today.
Thank you, Fauzi, for having
now,
me.
we always hear about the skin whitening products and how popular it is, particularly in the Asian region, but it's on the rise here in Australia. Why?
Well, I think it's a combination of things. Obviously, the nature of our population in Australia is changing. Where I practice in Ultimo in Sydney, it's a very diverse population, a lot of overseas students. It's a typical inner city mix. So I think as Australia's population becomes less Anglo-Saxon, we see more of this.
All right, well, talk to us about this fascination to lighten one's skin. Why the need to be fairer?
Look, I think this is a deep-seated cultural issue. I don't think it's one that's going to change overnight. I don't agree with it, but I mean, I'm Indian and I come from the same background. Everyone who's dark wants to be fair, everyone who's fair wants to be brown. So, but the problem is it's an issue of education and patient safety. People are exposing themselves to all sorts of dangers by not seeing a dermatologist, not knowing what they're treating, buying things that are over the counter, often no TGA approval in foreign languages, online. They have no idea what they're using on their skin, and they are exposing themselves to all number of potential issues.
So talk to us about this, the long-term impact of using skin whitening products. What does it actually do? Does it work in the first place?
Well, look, there are certainly skin whitening products that I, as a specialist dermatologist, can prescribe for certain conditions, hormonal pigmentation such as melasma. But again, the first step is diagnosis. The over-the-counter products do tend to be weaker, the ones that are TGA approved in Australia, which is a good thing. However, they can still cause significant irritation, thinning of the skin, redness, allergic reactions. They can cause birth defects if they're used in pregnant women or women who are breastfeeding. Women who may not know they're pregnant and are using these products may not find out till 3 months later. Very important part of the sort of embryonic stage of development for babies. So there are all of those issues. Hydroquinone is banned in Europe, but as a dermatologist we do prescribe it, but again it's with the proper diagnosis and education. I mean, it's taken me 18 years of training to become a dermatologist. This is not something someone's going to Google and be able to work out, you know?
Of course, it also speaks a little bit to the need to fit in, isn't it? I mean, you know, when you turn on to TV, you see a predominance of blonde, white teeth.
Yes, it's true.
And that's what you want to be, so you want to fit in.
I always wanted white skin. My mother told me if I was dark, she's going to hate me for this, no Indian boy would ever want to marry me. Well, I didn't marry an Indian boy anyway, but, you know, so yes, she always told me to cover up from the sun and all of those things. So, look, it is an issue, definitely. How we address it, I'm not sure. And I think Anglo-Saxons had the same issue back in Victorian England. You know, they all wanted to look white. They wore gloves to have lily white hands. It's just that the perception is that with Anglo-Saxons that if you're sort of browner, you have greater economic security, you're able to go on holidays, it's about leisure time. And it's the same thing in Asian and Indian cultures, it's just the converse, you know. The whiter you are, the more time you have up your sleeve, you're not a peasant working in the field, etc.
Now, it isn't just skin whitening products as well. We are seeing a lot more Asian youth starting to go under the knife to get sharper noses, bigger eyes. Again, does that talk to needing or wanting to fit into this, I guess, Australian image of the tall, blonde, white?
I think so, absolutely. Look, you know, I see young overseas students, often from Korea, who are only 20 and they've had nose jobs to try and, you know, sharpen the sort of flatter nasal bridge. I get a lot of patients, because I do a fair bit of cosmetic dermatology as well as medical dermatology, who want facial slimming with muscle relaxing injections. It's difficult. Look, I don't judge, but I think it is a worrying trend. I think we should all celebrate our different racial characteristics. And it is true that one of the first signs of aging in Asian skin, Indian skin, is pigmentation, brown splotches and blotches, but they can be a wide variety of things. I mean, it could be melanoma, for goodness sake. It could be a pigmented precancerous spot. It could be hormonal pigmentation, or it could just be from years and years of Australian sun without much protection. But there are many better ways to treat than over-the-counter skin whitening products. But again, I say, go and see your GP, get a referral to a dermatologist, and let us make the diagnosis and look after you and manage you in a way that is best for your skin and your need and your budget. You know.
Dr. Ritu Gupta, thank you so much for coming in and speaking
It's a pleasure. Thanks for having me.